You're watching Let's Chat.
Welcome back to Let's Chat. I'm Taylor Bishop. Well, joining us now from Erlanger Health System is Dr. James Fleming. Good morning, doctor. How are you?
Good morning. Thank you for having me.
Good morning. So we're going to talk a little bit about the coronavirus and how people can still get in touch with their patients and how people can still come in, even though despite everything that's going on with the pandemic. So my first question for you is, with heart attacks and strokes are serious, and it's important to get that information and go to the ER right away. How can people be sure that the hospital is still safe during this pandemic?
That's a good question. I can understand your concern. There's a lot we don't know about COVID-19. Our medical community is still learning about the dangers it poses and also the populations at risk. However, we know a lot about heart attacks and strokes, and we know the risk of sudden death or lifelong disability are real. And don't allow yourself to be a victim of COVID-19 by not getting medical treatment for your other conditions.
Working on using the use of telemedications, I hear, during this pandemic. Is that something you're using in your practices right now?
Yes. So the CEO of our hospital has made safety a priority, both for patients, staff, and visitors. So I don't want you to be feeling like you could be a victim of the pandemic by not getting your medical treatment cared for. So some of the things we put in place include masks for visitors. Also, we have limited the number of seating in areas and also the persons in the elevators, and also ask that people have their temperature checked if they're visiting the hospital. So these are some of the procedures in place to help you feel safe. Telemedicine is a means of discussing with the patient their medical care over the internet. It uses an application called Zoom, and some of the medical staff at Erlanger are offering this service through their clinic. You should call your doctor office and see if that's right for you. And certainly, if you need to have a procedure done, you'd have to come in, and in that case, we'd still make your safety a priority.
And Dr. Fleming, dealing with having family and friends that are at Erlanger, are you allowing visitors up at this time? And if so, how can they receive updates on their current conditions?
Good question. Erlanger is restricting visitor access in order to protect our vulnerable patient population. There are exceptions. For example, if you have intellectual disabilities and need a family member to make you feel comfortable in the hospital. Also, patients who are at the end of life can have a visitor with approval. So there are some exceptions, but generally we would prefer to call you, either the doctor or nurse, to give you updates. And we certainly respect your history and perspective, since you know your family members better than us, but you can expect to get updates regularly while we take care of your patients in the hospital. I'm sorry, your family.
Yes. And then lastly, doctor, how are you and other healthcare workers holding up during all of this? How is your morale going during this whole pandemic?
Doctors, nurses, and therapists are people just like you guys and have families and concerns at home as well. But what I see in the hallway is the vigilance and the dedication to get this job done. I'm reminded of Winston Churchill in one of his speeches, who once said that we will not fail or falter, and we will get this job done. Give us the tools and we'll do it right. And to paraphrase, that's really what we're after at Erlanger. We want to care for your family like we have for 100 years, and we're going to get through this pandemic together.
Beautifully said. Thank you so much, Dr. Fleming, for taking the time out to speak with us this morning, and we appreciate everything you and the people at Erlanger are doing for us. Thank you so much.
Have a wonderful day.
Thank you as well. We'll be back with more Let's Chat after this.